Welcome to day 19 of the Charms MediHelps Foundation Black History Month. Today we have a special speaker who's going to be talking to us in reference to vision care for the African American community. Now, vision care is important, so this is for all patients. However, there's a special focus this month on the African American community and what we need to do as far as our vision is concerned. How, there's a resource out there that many people don't know about because it's very seldom spoken about, especially in the underserved, the marginalized, and the disabled communities. And it's important for them to know that should they find themselves or their loved ones find themselves in a situation where their eye care is declining, they need additional help, maybe they need glasses or they need to go to the eye doctor and they just really don't have the funds to be able to afford it. They need to know about this all important organization that's available that will help them. So, without further ado, what I'm going to go ahead and do is introduce everyone, whether you're listening to this tonight, whether you're watching it during the daytime, perhaps you're catching it at some other point in time. What I'm going to do is go ahead and introduce you to who it is that we will have speaking this evening. And I say she's special because she's actually also the vice chairperson for the Charms MediHelps Foundation. So and we've been friends for a very long time. Uh, we're not gonna, either one of us are going to tell our age, but it has been a very long time. And when I met Miss Lisa, I met her under some really weird situation, or I was going through something, and I was introduced to her, and she's been a friend since that day. And I am forever blessed, and I'll forever be thankful that me and her met because we formed a bond that will never be broken, and that, like they say, she's a sister from another mother. But I love her nevertheless, and I'm so thankful that when I needed assistance with the Charms MediHelps Foundation, that she stepped up and said, "You know what, Sandra, I'll do the vice chair." And so she took on that role, and she's been graciously serving that role. So I'm so forever, once again, forever thankful to her. Lisa Coleman is an entrepreneur, an enterprise. Today's Monday. An enterprise risk program manager at Savannah River Nuclear Solutions in Aiken, South Carolina. Lisa has more than 30 years of experience in software engineering, IT support, and risk management. Lisa is active in her community, assisting with teaching grants, encouraging participation in internships and co-ops, speaking at local colleges, events, and mentoring middle and high school students. She earned her Bachelor of Science degree from Xavier University of Louisiana in mathematics and computer science, and has a master's degree in computer information systems from the University of Phoenix. Lisa is also a certified Blue Dragon lead apparent cause analyst, root cause practitioner. In addition to that, every organization that you and I could possibly mention, she probably belongs to it. And not only does she probably belong to it, but she's probably, up until recently, did she decide that, this is way too much. She's probably has some type of role where where she's got to be busy at. And so one of those roles that she's undertaken, she's not an officer, but she's a big part of the Links Association, is the Links Association / organization. So without further ado, what I'm going to go ahead is introduce you to Lisa Coleman and let her tell you all about her life, and let you, more importantly, tell you all about the work that she does with the Links and what the Links does for patients who are going through with their vision and their eye care. Lisa, on to you.
So thank you, Sandra. You know, I love you. There's nothing you can do about it. How about that? Um, so today, even though I'm normally always active with the links, today I'm going to talk about the Lions Club International. I've been with Lions since I was a little girl. My grandfather was president of the Lions in Chicago. My mother is still president of the Lions in Chicago. And so it's always been a thing in my family where we are committed to serving, right? And with that, I'll just jump right in and start telling you about Lions International. And again, I'm a member of the Chatham Lions chapter in Chicago, Illinois. And that is because my mother is still the president and I want to support her. So, of course, I'm going to be a member of her club, even long distance. But I want to tell you a little bit about the organization and some of the things that resources that are available to the public. Okay. Um, with that said, Lions Club International, it was founded in 1917 by a Chicagoan by the name of Melvin Jones. And pretty much what he wanted to do was get a bunch of businessmen together and make a difference in the community. So he got these people together and they started the Lions Club with the focus on trying to give back to the community. They eventually grew. And in 1925, when they had a convention, there was a individual by the name of Helen Keller. She gave him a challenge. And she said, I would like for you to be the Knights of the Blind. And one of the reasons she was so passionate about that was because when she was a toddler, she was blind. And from there, she had to learn how to navigate life, of course. And she became a strong advocate for those with disabilities. And so she needed other people to help her, of course. And with that, that's where the Lions Club came in. So one of the main things that we do is we help those with vision impairment and those who are blind. To help those who are blind live a better quality of life, and those with vision impairment to improve upon that. So let me give you a little bit more information about us. We're headquartered out of Oak Park, Illinois. We have about 1.4 million members. Our president is Dr. Patty Hill. And when you start looking at the numbers of what's going on with people and their eyesight, it becomes real interesting, right? So there are about 1 billion people that have some kind of visual impairment, whether they wear glasses or something's going on with their eyes, right? And what we also know is that 253 million are blind or have some kind of severe um, disability going on with their eyes. And what's staggering is that 75% of this is avoidable. It's avoidable. In the US, if we get a little bit more specific about what's going on with us in the States, because we're an international organization, but in the US, a lot of the issues going on with eyes and eye care have to do with our age. So the older we get, the more issues we begin to have with our eyes, specifically macular degeneration, glaucoma, cataracts, and diabetic retinopathy. Right? So those are the things that impact a lot of people. Now, when we start drilling down some more and we look at African Americans, what we know is that a lot of African Americans have high incidence of diabetes, right? So Native Americans and African Americans, we have these high numbers when it comes to diabetes. Blacks are twice as likely to develop diabetes and 2.5 times more likely to be hospitalized because of diabetes, right? So, with that said, we need to kind of get a grip on what diabetes. That's something we need to get a grip on because it impacts us so severely. So when I think of my family, when you first asked me to talk, and I thought, okay, what can I talk about? The first thing I thought about was eyesight. One, because my whole life I wore glasses until I got LASIK surgery. So now I just have readers when I'm reading stuff. But other than that, I've been blessed lately not to have to wear glasses. But if Black people really think about it, most of us have people in our family that wear glasses, or they've had cataracts removed, or they've been dealing with glaucoma or something. And I've had people really close to me dealing with the whole issue of macular degeneration, where they've had to get shots in their eyes, and it's not something that you really want to have to do. Or just as time is going by, losing their vision. And one of the most important things that someone can do to retain their vision is to simply go to the doctor. Now, I'm not a doctor, but I'm smart enough to know I need to go and to keep up with these statistics, right? A lot of people may say, well, that's easy to say. I don't have the resources to go to the doctor, or I don't have the money to go to the doctor. But understand there are resources that are out there for people to utilize. And that's one of the areas where the Alliance comes in, right? Because a lot of what we do is to help those that are either low income or middle income have access to eye care. And so, no matter what state, well, first of all, let me go back to who we are. We also have a foundation. And with the foundation, that's where we're able to provide the resources to help. Most states have the local foundation, like in Illinois, is the Lighthouse in Illinois. And in Georgia, you have the Georgia Lighthouse. So you can, as an individual, if you say, hey, I just simply don't have the money, contact your local Lions Club and see if they have vouchers so that you can go get your eyes checked, get your eye screened. If you're unable to contact your local Lions Club, then Google. Go online and simply Google. If you Google foundation or lighthouse in Lions, trust me, something's going to come up, and you can call that number and find out how you can get a free screening or low to no cost eyeglasses. Now, in addition to that, you can go to a website, a government website, and that is the National Eye Institute. And not only will you see Lions Club, but you'll see some other organizations that are offering free screenings and free eyeglasses. So do not feel that this is out of your reach. Everybody at some point should be going to the doctor to get their eyes checked. Just like every year, you should be going to the doctor to get screened for other health issues. Include in that your eye care, because it's just as important. Put that on your list of things to do when you start going to the doctor. I got to get my eyes checked too. Because it makes no sense for anybody to go blind or to get that close to being blind or losing their sight when there are resources out there available to help reduce that. Because again, 75% of the issues related to blindness can be prevented, but you can't prevent it if you wait and you just let it get worse and it gets to a point where there's nothing you can do about it except live with it. So Sandra, did you have any questions you want to ask, or I don't know if I can answer them, but
you're gonna try. We do have two comments, and then I'm gonna actually add a personal story to it. Carolyn Coleman's here. She's saying hello, everyone. Sheree Reed is also here, and her question is this: I'm looking into having LASIK surgery. Was there any pain during or after the procedure? Before you answer that, I do want to tell a personal story of something that happened to me. It may have been, I want to say I had to have been maybe about 15, 20 years ago. I went to work in the morning and I came home. I went in the mall, was going shopping. I came out of the mall, and what occurred was I had all types of strings hanging in front of my eyes. I got home, I told my husband, I said, blow my eye because I got something in my eye. I really didn't know what was in my eye. I just thought I had something in my eye. Well, over the weekend, I kept having him blow in my eye because I just thought that I just thought that it was about, my eyesight, right? Like I just really had something in my eye. Now, mind you, I had been tested for diabetes because my mom was diabetic. So, and I have sisters that were diabetic. So my doctors kept trying me for diabetics, testing me for diabetes. Well, all of the tests came back normal. So when we called the eye doctor that day, I called my primary doctor. She said, go see the eye doctor, and she told me where to go. We went over there, and the ophthalmologist was like, you have diabetes. And I was like, I don't have no diabetes. Like I literally told him off because he told me I had diabetes. And everybody that knows me knows that I have a tendency when I'm very, very passionate about something to literally go off, right? So I was actually going off. I was like, I don't have no diabetes, and they tested me. And that. So the doctor was like, okay, I'm telling you what's wrong, right? So she sent me for a final test, but this time with the test that she sent me for was unlike a regular vision test. Like she sent me for MRI, she sent me for all this other stuff to rule out diabetes, since I was so for sure that it wasn't diabetes. Well, what occurred was I was diagnosed with diabetes. What happened with my eyes was that I had a detached retina. So with me having the detached retina, of course, I had to have surgery on my eyes. But that's why it's important to, one, go to the doctor. Two, have a conversation with your doctor when these things happen, and listen. Especially if you're in. And why it's really, really important for you to have a medical team that you trust, right? Because if you trust them, you'll listen to them. So when she told me I'm gonna send you for all this test or whatever, I said, fine, okay, send me. But I know you just ran all these tests and nothing came back saying that anything was wrong with me as far as me being diabetic. So that was like a blow to me. But I'm glad that I had the foresight to listen to her and to go see her, because without me going to see her and say I was at home and I just kept messing around with it, right?
That part. Yeah.
I probably wouldn't have been able to see. I mean, I was already struggling with my eyes anyway because I can't, like, I have my peripheral vision is shot. So I can't really see on the sides of me, but I can see perfectly in front of me. So I was already having problems. And I'm kind of pretty much, when she was telling me all of this, when she was talking this diabetes, my mind was like, no, this had nothing to do with it. It's my peripheral vision, whatever, right? But I mean, years later, and they actually had to do the surgery immediately because it had detached to that point. But years later, I'm okay with it. I'm fortunate enough that I will have to wear glasses for the rest of my life. I don't, think I will ever be a candidate for LASIK, because what you just said, Lisa, in reference to as you age, because as I continue to, get older, now I'm looking at now I'm looking at the fact that glaucoma is starting to set in. I'm not at the point where I need surgery for the glaucoma, but I know at some point in time, because they've actually already told me I am going to need. They see the symptom, see the signs when they look at my eye. I have to go to a retina specialist every year for appointments. But now what they're waiting on is for that point to come where I actually will have to have the glaucoma surgery. So your eyes are very, very important to you because it helps you to see. It's a sense that you definitely need. So I wanted to add that to the conversation, because I believe if I'm helping you, then I need to be able to be honest and transparent with you. I don't need to be sitting talking to a patient and saying what this, that, the other without having any proof or having any direct tie to it. So it's important that I tell my story when it comes down to my eyes. So we can actually go back and we can actually answer Sheree's question, if you don't mind. Was it a painful procedure, the LASIK?
No, I don't recall it being painful. Uncomfortable because I don't like anything close to my eyes, so they had to coach me through some things. But painful, no, I don't recall that. I think the only thing that kind of threw me is I thought once you got LASIK, um, you wouldn't have to wear glasses ever again, right? But no, you still will. And it depends on the kind. So let me not speak on every procedure, right? In my situation, I still have to wear glasses as readers periodically, but I don't have to wear them just to walk around the house or to drive a car, anything like that. It's just periodically when I'm reading. That's when I have my readers and I, do what I do. Um, which for me was major because my whole life I always wore glasses. So that was a big leap for me. Somebody else will say, "Well, that's a waste of my money and time." So I don't want to do that. Now I would tell you Lions may not cover that. You probably will come out of pocket for something like that. So Lions is really for, if you have no support or help whatsoever with your eye care, and they'll help you get eyeglasses, period, so you can see. The goal is for you to be able to see, or help with resources if you are blind. That's the goal of Lions. But I chose to do that for myself and to pay out of pocket for myself, with the LASIK. And I want to go back to what you talked about, um, your experience. So many people have that experience. Like once you hit 50, you really got to start seeing that eye doctor because it's little things that are happening and you don't even realize that this is serious or this is severe. And before you know it, you're dealing with some of the things that you just talked about, right? And I think that in the Black community, we're not talking about this enough. We're assuming that it's just us, or we try to dismiss it, like we try to dismiss a whole lot of health issues, and you simply cannot do that with your eyes because it's you don't want to lose your eyesight. You don't want to lose your eyesight. And I think for me, it's like it's personal because some of the stuff you just said, I had a conversation with a loved one today about, just today, with some of the same descriptions that you said, because you're thinking, oh, it's going to be one thing. And, talking to that loved one, it was like all three of the different things. It was the retina issue, it was the glaucoma, it was the what else did she mention? The cataracts and getting the artificial lens on her eyes, both eyes. So it just starts to escalate, and you don't want it to escalate, is what I'm trying to say.
Thank you so much. And you're right. Like you just said, you don't really want an eye issue to escalate to the point where you can't get help for it. As I've stated from February 1st, and I'll continue to say it, even when Black Health and History Month is over, I'll continue to say it. We only get one life. You only get one. You're not coming back. I mean, AI is doing some fantastic things right now, but I'm sure you probably are tired of hearing me say this, but I gotta say it, and I have to keep saying it. I don't want AI to bring me back. When I leave this world, I want to
You say
leave.
you gone.
I'm gone. I want to leave a legacy behind that people will have a footprint to follow in. But don't be talking about, well, we're going to freeze her for 30 years and we're going to bring her back. Yeah, I don't want that. I don't want that. I mean, my time was here. I was here doing my thing. I did what I needed to do to encourage other people to always, always, always keep an eye on their eyesight. And that's all that's what I have to do. We have a LinkedIn user, and she's saying, or he is saying, hello, everyone. Hello, LinkedIn user. I do need you to put your name in the chat so I know who it is that just came in and said hello. Appreciate you stopping by. Carolyn Coleman wants you to tell her more about the Lions Club. Now, it's the Lions Club, and before you do that, Miss Lisa, what I do want to say is I am so sorry for everyone that belongs to the Lions Club or knows anything about the Lions Club. Please know that when I said the links earlier, I was confused. And I knew she was.
But I am a member, but yeah, I'm
Yeah, but I
representing.
know that she was talking. I knew today she was going to come in and talk about the Lions Club only. Add the L's and the L's and the B and Monday. So please don't blame it on the heart, blame it on the head. When I confuse those two, it wasn't meant. Thank you, Darlene Christie, for stopping in and listening in for today. And now Carolyn wants to know more about the Lions Club. So what? Well, one thing I do want to know is this the Lions Club now international?
Yeah, it's been international for a long time. It's an international organization. And if you go to the website, you can learn more about it. But like I said, our whole purpose is to serve. And so we serve not only just with raising money and helping with eye care and stuff like that, but we also help when there's a national disaster. I mean, a global disaster in some country or whatever. Lions are everywhere. It's a global organization. So what I love about it is when there's some kind of natural disaster that takes place in that country, it's always people that have boots on ground in most of these locations, and you can immediately, if you want to make a donation or help, you can help out, and know that the money is going to those local people, because we have so many locations everywhere. So we help with that, and we also help feed the hungry. And so we volunteer and donate at different churches and things and help with food distribution. So it just depends on your club, what your focus is, but we're always doing different things to serve. The best way is to go to the national website. And if you want to become a member, go to the national website and then look for a location that's near you. And then you can join a location that's near you. If you don't have a location near you, you can look into starting a club. And again, if you go to the national website, you can find out more about that. And I can say national because I'm used to saying national, but it's really international. And again, we have the Lions Club International for the clubs, and then you have the foundation that pretty much is where our different programs are ran out of. Like we have one program called Sight for Kids. And what I love about that particular program is they work with school districts, local organizations as well, and local government to ensure that kids are getting eye screened on a regular basis. Just some of the things that we do.
There's a question for you because that brings up a very good point in reference to the kids getting eye training, right? Is that for all schools? Because we got a lot of schools now, and is that for any kid? Because what happened, I mean, is that also open for the children that are homeschooled? Do they also have eligible? Can they also take part in the Lions Club Sight for Kids program or Sight for Club? Yeah.
Normally, when we work with the community in general, one of the Lions clubs will see about. So let's say, I'm just giving an example. These are just examples. A club may find out there's a fair going on in the community, and they will check into seeing if they can get the hearing screening bus. That bus will come out, and then anybody in the community could get a free screening on the spot. So that's the kind of stuff that we try to do. And again, it depends on that club and that community, how active they are and the kind of things that they try to implement. Because any club can figure out whatever they want to implement. Now, a school can actually contact the international organization and ask to see if they can have a representative work with them with the Sight for Kids program.
Okay.
To address your specific question, that school could contact them directly on the internet at the international website and find out more information about getting that program at their school.
Right, but what if they're homeschooled and their home is their school? So what do
That's when you would reach out. That's when you would probably, I would tell somebody, if that is their situation, reach out to a club and then or reach out to the national organization and they'll put you in contact with a club. And then that club will probably be able to get you a free voucher to go to your doctor and use, or go to a specified doctor to use that free voucher to get your eyes checked for free.
Okay, so it's just a
And even if you can't afford eyeglasses, um, if you're low income, they can probably give you a voucher for eyeglasses as well.
Okay, so it's just a matter of reaching out and actually using. And for those that are listening, if you're like, okay, well, I don't know where would I find my Lions Club out? Are you sharing information about this free program that you're hearing about, especially for our children? And you know, you're not sure where you can actually get the information from, reach out. I mean, you can send me an email. Hey, Sandra, where can I find this at? You could use the sites like findhelp.org. They'll find you. You'll be able to go in there and put free eyesight. You can use the 211 .com site. Those are sites that the Lions Club will be listed in, and they'll be able to tell you exactly where you can go. And we do have Tatanisha Tucker who just joined in, and she's saying hello, Miss Coleman. So
Hey, Tachanisha.
you have people that are listening and are looking, and we thank you, and we certainly want, if you have questions, we certainly want you to answer those questions. So Miss Lisa, I was looking at the Lions Club website and I saw like a virtual club, like there's different memberships for people.
So since and I may be wrong on this, but I think that started around COVID, or got popular. Let me put it like that, around COVID. And I think they're still implementing that, right? Where you can have virtual clubs. So that's something that's relatively new, not new, but relatively new. I think that's great, because then that means, if you're not close to a club, you can just go ahead and see about starting your own virtual club.
Okay, then there's some other clubs that they're talking about, like the campus club. What exactly is the campus club? Is that a club that's started for universities?
I would think so. I'm not certain because I haven't heard about that one, but it sounds like that one is on a college campus.
And I'm just wondering, if it's on a college campus, is it just open? And perhaps someone is listening to this that might be able to give us some more information in reference to the campus club. Is it something that's just for the students that's at that particular campus? Because spread throughout the United States, in each state we have more than one university. So I would hope that in fact what that campus club would allow is that, if you say in Chicago, I'll just give you an example. We got the University of Chicago, we got DePaul University, we got Northwestern. If you show up with a student ID and you qualify for the Lions Club programs, I'm hoping that they'll let you go. You take place.
So I'm hearing two things in that statement. Are you saying to become a lion, or are you saying to utilize the resources associated with lions?
No, I'm saying to utilize the resources, because if it's set up at the school, it's set up at the school. Some schools are very, very protective about who they let
Yeah.
certain programs that they are having at that
Yeah.
particular school.
So because what I'm sharing with you is information on how to go to the doctor, right? How to get your eyes checked.
Okay.
That's for anybody who's low to mid income. That's who it's for. So that part, it really doesn't matter, right? But to become a member of Alliance, that's open just about to anybody as well. So it's just a matter of if you like that. And I can't speak for the college campuses. I really can't. But what I can say is Lions is extremely inclusive, extremely. So they welcome families to join, like literally whole families to join. Uh, Old, young, they invite everybody to join in Lions. They do have a younger component of Lions called Leos. And again, if you pull that up, you can learn a little bit more about that. But sometimes those in their 20s, I believe, somewhere thereabout, they can join that organization and be more comfortable and be around their peers versus some of the other clubs where you have older people. But it really doesn't matter. It's very, very inclusive. They invite everybody to join Lions, but to take advantage of the resources, it's all about the income level, to make sure that everybody has access to good eye care.
So I have a question for you that you just brought up, which is very, very mindful of a couple of things that are happening across the board when it comes to healthcare. You say it's income based. And so I'm hoping that means it's the, what is it, 400% below federal poverty level, whatever it is right now, below that federal poverty level. But therein lies an issue because plenty of people, if you look at what they put in paper as far as how much they make, what do their family, what is their family income, it looks good. But then when you take away everything that you got to pay for, like, really pay for, especially if you're a patient that has other medical conditions and other medical concerns, that income is slowly dread. You really don't have access to it. So
if I could look it up real quick, and I can't look it up fast enough, but I don't think it's that. I don't remember it being that stringent. I may be wrong, but I do not remember it being that stringent. I hear where you're going with this. Like, do you have to be so far below the income that you don't qualify? And the short answer is I do not believe that. I do not think so. I think there's a little bit more discretion with that because they really want to also be inclusive of people who are middle income that are just struggling right now.
Right, and that's a vulnerable community, so often
middle income is struggling right now.
Right. I'm often asked, Sandra, what's the difference between the vulnerable community and the under-resourced community? Well, the under-resourced community is just that. It's under-resourced. The resources are not there so that the patients can have access to the best health outcomes. It's not going to happen because it's an under-resourced area. No matter how you try, whichever way you cut it up, it's not going to happen because they live in an under-resourced area. Now, you have a vulnerable community, they're middle income, they make, decent money, but they have a ton of bills. They got kids that got to go to school, or they, got car notes, house notes, whatever. So that information, when you look at what they put on paper, and you see, oh, man, they make $150,000. But if you spending all that money on the necessities of life and everything as far as cost goes continues to go up, well, how much do you really have? I was talking to someone the other day that was asking me a question about my income, and I told them what my income was, and it was like, girl, you got it made. And I'm like, really, I don't, because I chose to, and this is my own choosing, but I chose to add a functional medicine doctor to my medical team because I felt as though that would give me the best health outcomes. Well, that functional medicine doctor, she's not covered. And in addition to that, the supplements that I have to take to continue to live are expensive. So you say, well, Sandra, then just go to the regular doctor and just take the medicine. I don't want to do that because I don't feel as though that's going to help me. And then I don't feel as though that's going to prolong my life. So while what I'm putting down, it looks good, it looks decent. If I'm spending 70% of that on medicine that I have to continue to live, I really don't have the money. So that's why I was asking. I think you understood that part, Lisa, what I was asking about.
And you see me moving around over here, and that's because I was trying to pull up the application real quick on one of them. And again, I can't guarantee for the state of Illinois it looks the same, but I don't even see a line where they say, tell me the exact amount you make.
Right.
So I say it's a little bit more flexible. Do you understand what I'm saying?
Right.
It's more discretionary of them being able to help you versus, well, nope, you missed it by $2. Right. You can't get it. It's not like that.
And you know what? And that's what happens so often in our community is that,
especially middle class, because you're too rich to be poor, too poor to be rich.
Right. And so you miss out on a lot of the benefits. But once again, it hurts our community the most, is where it hurts at the most, because these programs are out here and no one is really talking about them or sharing the information about them.
Or
So
you think you don't qualify, so
right,
you exclude yourself.
right, and so you don't even try. You're like,
You
I'm
don't try.
making
You exclude yourself
right,
because you say, "Oh no, I don't
right,
qualify for that. I make too much."
right. And we have to stop just automatically assuming that we make too much money, because in a lot of instances we don't make that much money where it wouldn't, qualify us for the different products that they offer. And once again, there are so many options out here. You have the Lions Club, you have the other clubs and organizations that deal with the eyesight, but you also can go to schools that actually have vision care as part of their programs. And a lot of times, those schools will actually take you as a patient and charge you on a sliding scale. So if you go in and you don't make that much money, you you still have access to it and you can still use it, because they're not using all of your income. There are other, options and choices that you have, but in our community, it just really saddens me, and that's why I started the Charms Many Helps Foundation, because too many people were going around without having access to anything when the services were there. And unfortunately, what happens is that when we don't use what they put in our community, they take it
Yeah.
out of our community and they put it somewhere else where you cannot get access to it. And so that's hurtful as well, is to have these programs moved somewhere else where you can't get access to it, or you don't know about it, or any one of those things is just really harmful to us. So I take the time right now to thank you so very much for coming in tonight to talk to us about the Lions Club, to share with us those thoughts and those processes in reference to what goes on, what happens with the Lions Club. Do you know of any other clubs that are out there that do like the same or similar to the Lions Club?
Not clubs. The government has a website, National Eye Institute,
Mm,
and you'll know it's the government because it'll end in .gov. But if you go there, you'll see other resources that do some of the same stuff.
okay,
National Eye Institute.
right.
Okay.
Yeah. Please make sure that what you're looking at when you look at the resources, please make sure that they are legitimate resources that
Resources.
you're looking at.
Yeah.
If we I can't stress it enough. You would think, well, who would make up something at the National Eye Institute? Why would they do that? But they do. And they do that to get your information, to pretty much spam you to get your information. You're not thinking, you're putting in your social security number, you're putting in your banking information, you're putting in all that information, and you thinking, okay, well, they're going to call me in a couple of days because I went online and I filled this out and they said that I qualify for this program, and then you never hear from them, and you never hear from them until the bank is calling you, or you go into the bank to check on your accounts, and you find out that you have no money in your account. But what
And
happens?
Sandra, let me say this as well. The main message I guess I want people to walk away with is that they begin to add eye care in their annual screenings of everything that they do, and that this is important and that they need to make it a high priority no matter what. Make it a high priority because you only get one set of eyes.
Yeah, well, and that's true. That's it. I mean, that's a big part of your life, is you actually seeing. So, with that being said, I'm going to go ahead and close out day 19. Please stay involved. Please use your voice. Please advocate for yourself. Please know, especially in the African American community, that there is help for you. Please know that we're here for you. Charms Medi Helps Foundation is here for you. I stay in contact with my cohorts, which are independent board certified patient advocates. they're there for you. Advocates that work at facilities are also there for you. But you have to start taking advantage of the services that are out here, the resources, the options that are out here. You cannot keep saying, well, I'll take care of it later. What happens later? What happens if something happens later? What you gonna do? Right? How are you gonna act? What course are you gonna take if later never happens because you didn't take care of it then? So I want to take the time to once again to thank you, Miss Lisa Coleman, for coming on,
Thank you,
sharing
Sandra.
information about the Lions Club and doing what I expected for you to do. And what I love about all of our speakers that come on or have come on and that will be coming on in the next 10 days to help close out on a strong note, the Chimes Many Helps Foundation. I do say this. Thank you, thank you, thank you. Day 20, which is tomorrow, we will be having Miss Darlene Christie. You do not want to miss her. Her topic tomorrow is all about cardiovascular health, and she has a story to tell, a personal story that she's going to be sharing with us. So please, if you're doing anything and you want to know more about cardiovascular health, you want some tips, please, once again, let us know so that we will be able to have you with us tomorrow, which is 2/20, on the 20th day of the Black History Month event. And Miss Lisa, with that infectious smile you have and all that brains you have, close us out with 2 or 3 tips that you want us all to remember.
Whew. Okay. Don't be so quick to try to do everything yourself. I think a lot of times we try to self-medicate with our little herbs and our knowledge from our mothers and grandmothers. It's okay to go to the doctor. It's okay to trust the doctor and to get some expert advice. That's what I want to say is stop trying to self-medicate. Go to the
Yeah.
doctor.
It's not going to work. You self-medicating, a lot of times you wind up with in a worse condition than you was. Just go to the doctor. Find you a medical doctor. If you're with
Yeah,
a
it's really
medical
important.
team and you're like, I don't trust them, don't get mad and not go to the doctor.
Find somebody you trust.
Right. Right.
If you don't trust them, that's fine. You don't have to like them. I've
Right.
had doctors I did not like, and so I found someone I did trust.
And that
Find
doctor
somebody
that
you
you trust, make sure you asking them about the full screening. Now I do want to ask you something before we close out for the night. Do you know if there's like a push or a bill or anything that's been added to any type of health government, any type of state or whatever, to actually get it so that eye care is considered a part of a routine visit?
Right offhand, no, but that's a good question, and I'm gonna try and follow up on that. That's a good question. I like it.
Yeah, I mean, we encourage, but if there's something that we need to get on and
Yeah.
follow through, then we
Yeah.
definitely need to follow through with it because it's definitely, I get your point. We do need to add that as a part of a regular screening is eye care. I know we don't do it now because I just had my physical and there was no screening of any type, no eye screening, no hearing, none of that, right? And so
Yeah.
we need to do better.
Yeah.
All right, Miss Lisa, thank you. Have the rest of a good day. And everyone that's listening tonight, if you sent a comment and I didn't get to it because I didn't see it, I will be responding once we get off. I will have Miss Lisa. If it's a comment that's directly towards the Lions Club, I will have her go ahead and do what she needs to do to make a comment on whatever question it is that you ask. This link, as well as the other links that we have, is available for you if you'd like it because you want to show it. Please reach out, say, hey, Sandra, can I get a copy of that link for day 20? It's yours. We want you to have it. We're not charging you anything. If you want to give a donation, fine, but we are not charging you anything because the most important thing to Chimes Many Helps Foundation is making sure as many patients as possible get access to this information. So
Yeah.
we're not charging you for it, because this is coming from our hearts. This passion and this love that we sharing throughout this month of February is coming from you, and it's coming to you, and it's coming from love. So there's no charge, and by all means, just let me know, and I will make sure you get a copy of the link. Thank you so much, and enjoy the rest of your night.
Bye.